My name is Kahn, and I'm an optometrist working primarily in Buckhead and in Lawrenceville. It's been in my family for, believe it or not, actually, I'm the fourth generation. My great-grandfather practiced optometry in Birmingham, Alabama, and then my grandfather and my father both practiced here in Atlanta. I went to Southern College of Optometry in Memphis, Tennessee. Prior to that, I was at University of Texas in Austin. My primary goal when I meet a patient is to, one, listen to their problem. That's usually most patients' biggest complaint, is that their doctor doesn't listen. So that's the first thing I try to do, is to listen to what is their complaint. And once I've listened to it, what I try to do my best to do is to try to diagnose what that problem is, try to explain that then to the patient in their terms and their language, so that hopefully when they walk out of our office, they know and feel comfortable that their problem will be solved, and that they understand exactly what the problem is and how it's going to be rectified. Certain parameters need to be met to be a good candidate for LASIK. Just having the desire to get out of glasses is not that parameter. And so our job when people are inquiring is to make sure that are they a good candidate? And we stand behind that, and we're not a factory that tries to obtain every patient. Not everyone is a good candidate. And like I said, I use myself as an example because I would love to have LASIK and I cannot. And I think patients appreciate hearing that. They appreciate the honesty that we provide here, that we're not going to try to induce every patient just because they have a Visa card, that we're going to induce them into a surgical procedure. We want them to have the proper outcome. And because this is an elective procedure, I think it's incredibly important that we provide that proper outcome and that they do walk out of here seeing the best they've ever seen, and that they don't ever have a problem. I've been doing this for 24 years and I've never had a patient yet that has had any abnormality who electively wishes they never had LASIK. So we don't have any of those bad stories, because I think we do a very good job of diagnosing and making sure that each patient that has it done at George Eye Associates is an excellent candidate.